Hi, we're back with Dr. Neil Floch and his patient Linda Hegedus, 200 pounds lighter than you were a couple of years ago.
So Neil, Linda mentioned dumping as we were closing the earlier segment. Tell us a little bit about what that is exactly.
Well, you know, we have a big stomach naturally, and that stomach digests and breaks food down and puts water into the stomach and waters it down. So if you eat something really concentrated, like a bowl of pasta, it's going to mush it up and water it down, and then it goes into your rest of your system gently.
Okay.
But then when you eat something very concentrated, pasta, ice cream, and chocolate, for instance, it goes right into the small stomach, and then some of it goes out into your small intestine. And the small intestine is not used to seeing that type of food. So fluid rushes in from the rest of your body, and then you feel lightheaded, and your heart rate goes up, and you feel sweaty, and you get stomach cramps, and sometimes people get diarrhea. It's actually a good thing. It's a side effect of the surgery, but it prevents people who are addicted to sugar and carbohydrates from having those foods.
Because they learn quickly that if I eat this, I'll experience these negative
Almost
effects.
like a B.F. Skinner box where you're
Yes.
conditioning. Did you find that helpful to you, the fact that if you cheated, you got punished for it?
Yes, I wanted to be punished. I wanted to be punished to keep me on the straight and narrow, because I have done this too many times to fail, as I said before. And I want to emphasize also that exercise is key to success. You can't just eat a proper diet and not move.
Yeah.
So I'm grateful.
How did you incorporate that after, or how soon after your surgery would you say that you were able to incorporate some form of exercise?
Truthfully, to alleviate any blood clots, from forming in my body, I took very slow walks up and down my little dead-end road. And then each day I'd walk a little further, and then the cane went away, and then I was beginning to walk faster, and now I, like the leader of the pack, I can walk way ahead of everyone else.
Did your knee pain go away completely with the weight loss?
Absolutely. I could run up the stairs where before I used to sit on the steps, 13 of them, to get upstairs.
You know, what's the role of exercise in the whole metabolic weight loss program?
Exercise is just positive all the way. I mean, you need to start exercise right away. And patients, you know, we do laparoscopic surgery, so patients can get up that day after surgery and walk in the hall. And it starts there. And, you know, it's an individualized treatment. Most programs, we talk about a program and everybody goes to the gym in the same program. You need to treat every individual patient differently. So we come up with an exercise plan that the patient can do that's realistic.
That they're going to stick with.
Yeah, I know if we said, oh, I'm going to go to the gym for an hour a day, no way would I make it to the gym. I don't know if realistically Linda can.
Right.
But if you walk around the office, in the actual office all day long instead of sitting, that's exercise.
Right.
Or walking up the stairs or parking far away. So we come up with realistic exercise plans to continue for the rest of your life.
I
That's such an
found when I lost
important
I stopped taking elevators. I just stopped taking
That's
it, even
right.
for 5 flights.
Me too.
And it's wonderful now. I walk up with people who are 20 years younger than I am, and they're out of breath, and I feel fine.
Absolutely. I know.
So
You're right.
makes you feel young again. But these little things, how you change it. But it really is a complete change in lifestyle. It's
Correct.
One of the things when I was losing weight, I didn't like it when people said, "Well, you're on a diet," because a diet implies
That
a
it's finite.
time-limited
Correct.
period of change that then you go back to what you.
That's
And
right.
it isn't. You really have to change forever, don't you?
It's a lifestyle change, and I always liked and enjoyed healthy foods, but I just needed to control my portions. What I do is I take a child's plate every night for dinner, and I use that as my dish, and this way I'm not using a large plate and the food looks lost on a large plate. So I feel I have enough food to eat, and it's really about portion and eating the right foods that are going to keep your body toned and strong.
And making that point about it being a lifelong change. It's not, like you said, Eric, a diet that's finite, and that once you're done with a diet and you've accomplished your set goal, you're going to go back to what you were doing before. which a lot of people, I think, feel that they can do. You know, I've lost my 30 pounds or my 50 pounds or whatnot, and now why can't I go back to doing a little bit of that? And then a little bit becomes a lot, and you know,
Right,
over
you'll go right
time,
back to your
you
300
go back
pounds
to your
again.
old
Absolutely.
habits. So it's really about committing to changing
Correct.
certain things about the way that you live your life.
The way I look at commitment is one day at a time, because I can only commit to the day I'm given. I can't look long term because that's not realistic to someone that's a food addict. It's one day at a time. Today, I will make goal. Today, what I set out to do and what I'm going to eat takes care of itself.
Yeah.
And Neil, you know, when should somebody begin to think about surgery? Because obviously everyone shouldn't have surgery for their obesity. So where is that line between somebody that can be successful with lifestyle management, and when should they start to think about
That's the
additional
golden question. And you know, everybody has to start with changing what they do for exercise, the foods they're eating, trying to change that. And it's got to begin there, not because, you know, some people I know it may not work and is likely not to work, but in order for the surgery component to work, you have to work at the diet and exercise, etc. It's not magic. It's not a magic bullet. This is hard work. It's just the extra step. So
even
people
with
start,
the surgery, it's hard work, right?
Right.
Absolutely.
But as far as qualifying, Neil, is there a weight over which or under which you're either a candidate or you're not, or there's no magic number for qualifying you or disqualifying you?
For instance, if I use a 5'4" woman,
Okay.
if you're 175 pounds, you're a BMI of 30, and we go by BMI, which is body mass index,
Right.
dependent on height and weight. So if your BMI is 30 and you have diabetes or hypertension or sleep apnea, you would actually qualify by FDA for a lap band. At a BMI of 35 in those medical problems, you qualify for any of the surgeries. And at a BMI over 40, which is 235 pounds at 5'4", you would qualify for any of the surgeries. And you know, to answer your question from before, most patients are looking for 3 to 5 years. They're thinking about it for a long time. It's, you know, it's not a quick thing to go into, but what's happening now on the other side is medical doctors are now understanding the need for surgery for certain people,
Right.
and recommendations from the Endocrinology Society is that surgery is now an option, should be looked at much earlier. Our International Diabetes Federation recommends surgery at a much earlier stage.
And maybe
at
to
this
give you a
point.
plug, that I know there have been studies that show that surgery can actually cure the metabolic abnormality of diabetes with the weight loss, and that people who have the surgery actually live longer than
Yeah.
the.
This is what I call the worst kept secret, because it is amazing. I truly find it amazing. Diabetes is resolved in 82% of patients who, at a year,
Yeah.
82% of patients undergoing gastric bypass surgery are off all medications with a normal glycosylated hemoglobin. Now, if you follow them for a long time, like 5 years, 42% of diabetics are cured off all medication after bypass surgery, and 37% after sleeve surgery. So they are actually resolved, and you got to be careful to use the cure word, but I
Right.
tend to use it. And they really don't need any further treatment.
And that's,
it's
you know,
absolutely amazing.
And that's
incredibly
because of the
happy.
weight loss,
Yeah.
specifically
Well, no.
because, or not?
There's another component, and that's what people don't understand. Beyond just weight loss, these surgeries change our body hormones, bile acids, and the way they interact with the food to give a positive result beyond just losing
That's
weight.
Beyond
a
just the
happy
weight.
note to end on, that we have to. It's a fabulous story, and you look spectacular. When I
Thank you
first
so
saw
much.
you in the green room, I had no idea that you were our bariatric guest for the day.
Truly
Thank you.
So
inspiring.
you
appreciate
look
that.
wonderful. I think you've given great information to the folks
Thank
at
you.
home, and hopefully people will begin to shed some of their pounds, because it's just so important.